Hello and welcome to the estrogen story. Today I will tell the tale that I'm sure many of you will be able to relate to. One about growth, change, and love. The tales of estrogen go back to the beginning of humanity itself. All those of ovaries have felt the pains and joys that such a hormone bestows upon oneself. In the estrogen story, we will explore the growth of a girl named Hormo, and how one day she seeks understanding about what is going on in her body after being terrified that something was wrong. The tale of Hormo begins with puberty as her estrogen levels start to increase, leading to the development of secondary sexual characteristics such as breast development and the onset of menstrual cycles. She deals with the troubles of not knowing what is going on in her body, fearing she may even die. In this fear, she seeks out the help of the esteemed Dr. Clang and Dr. Wang, who explains that everything will be just fine.
Hello, Miss Hormo. What brings you in today?
Well, lately something's been happening to me. My chest is inflating, I'm leaking blood, and I feel like my movements are all over the place. Am I dying?
Do not be on tenterhook, Hormo. What you're experiencing is simply your body undergoing the start of puberty, or the start of estrogen production in your ovaries. In fact, let us go inside and explore what is truly going on.
As mentioned before, estrogen is produced by the ovaries. The ovaries are located in the lower part of the abdomen on both the right and left sides of the uterus.
That's very fascinating. So there's sort of like two little factories down there.
Yeah, they're like factories that pump out hormones.
So what exactly does estrogen do? What is changing inside of my body?
That's a very good question, Hormo. Some of the major functions of estrogen are to lead the body through puberty, the regulation of the menstrual cycle by promoting the growth and thickening of the uterine lining, as well as stimulating the release of an egg from the ovary, the preparation of the uterus for pregnancy by encouraging the growth of blood vessels, increasing the thickness of the uterine lining, and regulating the production of other important pregnancy-related hormones, the maintenance of bone density and strength, and also looking after vaginal health, keeping it moist and elastic while promoting the growth of healthy bacteria.
Estrogen has a multitude of target cells due to its vast use in the body. Some of the tissues which most dominantly need estrogen are the uterus, ovary, breast, bone marrow, and brain. For instance, in breast cells, estrogen stimulates cell division and growth when they bind to proteins called receptors located inside of the nucleus.
That's incredible. But what I really want to know is how the hormone is triggered to be released from the endocrine gland and how it gets to its target cells.
You have such good questions, Hormo. Well, firstly, the reason you have started puberty is due to a small part of the brain called the hypothalamus, which secretes gonadotropin-releasing hormones, or GnRH. The pituitary gland, a pea-sized structure attached to the bottom of the brain, is then stimulated by GnRH to release luteinizing hormones, LLH, and follicle-stimulating hormones, FSH. These two hormones then tell your ovaries to begin releasing the appropriate sex hormones, such as estrogen, which then start puberty. Other than other ovaries, which produce estrogen at fluctuating levels depending on where the body is in the reproductive cycle, the adrenal glands and other tissues convert androgens to estrogen at a more steady rate.
Estrogen gets to its target cells by attaching reversibly to sex hormone-binding globulin, a protein, after being released into the blood circulation. The hormone enters the cytoplasm of the cells in the target tissues, where it penetrates the cell surface and attaches to an estrogen receptor protein. In the nucleus, the estrogen receptor complexes regulate protein synthesis by altering the rate at which certain genes are transcribed. Transcription is the process of making an RNA copy of a gene's DNA sequence. This copy, called messenger RNA, then moves from the cell nucleus to the cytoplasm, where it is used to synthesize the encoded protein. There are two distinct cytoplasmic receptor types for estrogens: estrogen receptor alpha and estrogen receptor beta.
What if I were to not have enough of a hormone, causing an imbalance?
Wow, Hormo, you're really testing our knowledge today. There is indeed a name for what causes hormones to be imbalanced: hyperfunction and hyperfunction. Hyperfunction is a rare condition where the endocrine gland responsible for producing the hormone is not producing enough of the hormone. This can be due to congenital or acquired disorders, autoimmune disorders, damage to the gland, tumors, infection, toxins, and vascular disorders. This condition can lead to a range of symptoms in the body depending on the specific hormone affected.
Hyperfunction is where the endocrine gland produces too much of the hormone. This is caused by a variety of things such as tumors or overstimulation of the gland. The result of this is symptoms in the body dependent on which endocrine gland is affected. Hyperfunction can lead to hypothyroidism, where the thyroid gland is producing too much thyroid hormone, leading to symptoms like weight loss, rapid heartbeat, and anxiety.
What would happen if I would have too much or too little estrogen?
Well, Hormo, that certainly would not be good. Symptoms of hyperfunction of the ovaries include dry skin, tender breasts, weak or brittle bones, trouble concentrating, moodiness, irregular or skipped periods, and weight gain. The cause of hyperestrogenism, meaning a lower than normal level of estrogen, are age, because the levels decrease during menopause, eating disorders like anorexia, or genetic conditions, for example Turner syndrome, and hypothalamic amenorrhea, which is your body getting over-exercised and not receiving enough nourishment. This causes the brain to release the hormone that activates estrogen production, which stops your periods entirely.
Symptoms of hyperfunction of the ovaries include mild to moderate abdominal pain, abdominal bloating or increased waist size, nausea, vomiting, diarrhea, and tenderness in the area of your ovaries. The cause of hyperestrogenism, meaning a higher than normal level of estrogen, are medications used to boost low estrogen levels may cause your levels to become too high, an excess amount of body fat as fat tissue secretes estrogen, stress due to the high amounts of cortisol being produced, alcohol as it reduces your body's ability to break down estrogen, liver problems as the liver breaks down estrogen and eliminates from the body, and synthetic xenoestrogens, which are chemicals that act like estrogen, resulting in increased estrogen levels. Too much estrogen can also lead to a high risk of cancer because estrogen promotes cell proliferation, which requires the replication of more DNA, and as the DNA replicates, there is a high chance of a mutation occurring in the DNA, leading to cancer.
That certainly doesn't sound good. How can I prevent this?
Don't worry, Hormo. There are plenty of treatments available for both of these conditions, though hopefully you will never have to use them. For instance, for hyperestrogenism, hormone replacement therapy, moderately exercising, having a healthy body weight, reducing stress, and having enough sleep are all ways to treat hyperfunction. For hyperestrogenism, some of the treatments are aromatase inhibitors used to treat breast cancer because they prevent fat cells from making estrogen, and gonadotropin-releasing hormone agonists because GnRH agonists stop your ovaries from releasing estrogen. Additional methods to stop this are limiting alcohol intake, eating a healthy diet, and decreasing body fat.
Thank you so much, Dr. Clang and Wang. I think I finally understand what is going on in my body. Estrogen truly is important than a hormone, isn't it?
Oh yes, of course. Without it, we'd be a complete mess. It's my pleasure to help you, Hormo. Here's a little mnemonic to help you remember the importance of estrogen.
O. Ovulation, regulation, and control. E. Essential for bone growth and strength. S. Skin health, maintenance, and improvement. T. Temperature regulation and control.
R. Reproductive health maintenance and support.
O. Organ health and support.
Damn, I think my brain got bigger.
G. Growth and development regulation. E. Emotional balance and regulation. N. Nervous system health maintenance and support.
I can't thank you two enough. Goodbye, Dr. Clang and Dr. Wang.
No problem. And so, Hormo lived out the rest of her days content and pleased, knowing that her body was in the safe hands of estrogen. Isn't that right, Hormo?
I'm an old woman now. I've had kids of my own who asked the same questions I did. And thanks to those doctors many decades ago, I was able to answer them.
The end.
I'm sorry. That's it, yeah, well, that's enough takes.